Good afternoon and welcome to Body Talk. This week inside Body Talk, we will look at coronary artery disease with consultant in medicine and consultant cardiologist at UHWI, Dr. Mark Husang. Good afternoon, Doc, and thank you so much for joining us inside Alive for the feature Body Talk on Love 101. How are you?
I'm fine, thanks, Sarah. Thanks for having me on your show.
Oh, you're welcome. No problem. Thank you so much. Now, Doc, what is coronary artery disease?
Coronary artery disease. So, we have to look at what a coronary artery is. And a coronary artery is essentially the blood vessels that supply the heart. So, coronary artery disease has to do with when there is a narrowing or even a blockage of the blood vessels that supply this heart muscle. And as we know, blood vessels are responsible for bringing both oxygen and nutrients to different organs. So if the heart is not receiving enough blood, it starts to malfunction and give other problems such as chest pain or shortness of breath.
Oh,
Um, yes,
chest pain?
yes.
I wonder if I need to come to your doc because from the other day I've been feeling a little chest pain. I don't know what's happening right there. No, no. What really causes this disease to occur in person? You touched it a bit, but what really causes that to occur in
O-
person?
Okay, so coronary artery disease, in most cases of coronary artery disease, it has to do with a process that we call atherosclerosis, or basically a buildup of plaque within the blood vessels of the heart. Very similar to maybe like the pipes in your house building up with gunk, and eventually you have to call the
Oh,
plumber to rot it out.
yes,
Or else your pipe starts to back up and the sink starts to fill up or overflow.
yes.
Uh,
And rig
so
a
it
hook.
Yes, exactly, exactly.
Yes, yes.
So there are a number of things that cause atherosclerosis to occur. Probably the main risk factor is probably aging, but there are a number of things outside of that that increase your risk of having atherosclerosis or blockage of these blood vessels. These include things such as hypertension, diabetes, high cholesterol, smoking, lack of exercise, otherwise known as a sedentary lifestyle,
Yes.
and stress is also, or emotional stress is also thought to be play a factor in it, as well as genetics. So things that we inherit from our parents. So some diseases run in families, and coronary
Yes.
artery disease can be one of these things.
Okay, so if I feel a little pain in my chest area where my heart is, I it's a little cause for concern.
It can be, but we have to remember that the heart is not the only thing in the chest.
Yes,
So,
you're right.
so, so, a lot of people, they come to me and they say, "Oh, doc, I'm having pain in my heart," and they clutch your chest.
Yes.
And I always try to caution them on that, because it allows us, it's causing us to jump to conclusions without us first following a certain process. And when coming to a diagnosis, as with any type of diagnosis, heart or otherwise, we have to get a little bit more story. So it's usually not any one thing, but it has to do with the pattern, how it feels, how often do you get chest pain. For example, if you were in a car accident and you ran into a pole and the steering wheel hit you in your chest,
Oh.
and you said the next day or 2 days later, you said, "Oh, I'm having chest pain," I would say, well, it's probably related to the steering wheel that you collected in your chest, as
Yes,
opposed to
yes.
as opposed to your heart. Or if
Okay.
you were to say, "I'm having chest pain whenever I eat hot pepper," I would say, well, if you eat in it and the food goes into your stomach, and then you begin having the pain after you eat, then it's probably your stomach or somewhere along the line, as opposed to your heart. So
Okay.
heart pain tends to be more involved with things like activities. So if you're doing, for example, if you're walking and you begin having chest pain, and it's a consistent type of thing. So if you walk, for example, down the road and you begin having a chest pain
Yes.
every single time, then that might bring into a question as to whether this may be heart related or not. But there are many things in the chest. There's your esophagus or food pipe, there's your lungs, there are ribs, there's muscle, there's cartilage, there are nerves.
So
So
many things.
a lot of things. So
Yes,
so we
yes.
have to be careful before we jump to conclusions that
Yeah.
any chest pain may be our heart. It might be
Oh,
that we're just lifting furniture the other way. It could
you
be as
know,
simple as we just slept bad last night.
I never thought about that, Doc. So thank you so much for clearing that up because when we think chest, automatically we think the heart. But thank
Yes,
you so much for
very
clearing
true.
that up. Now, who are most at risk of developing this disease? I know you said it's genetic and stuff like that.
Right. So the risk of having coronary artery disease goes up as you get older.
Yeah.
And a lot of these things have to do with lifestyle choices. Lack of exercise being one of them, as well as the diet and food that we eat.
Guilty,
Um,
guilty,
Many
guilty.
of us are, especially
Yes.
in today's world where everybody's busy. You have to get to work by a certain time. You leave after a certain time. Or it's dark. I can't go exercise. Then you
Yeah.
worry about your security, which is another problem that we all face. The other pandemic, so to speak.
Yes.
Security is a strong concern. So you can't just walk out in the road anytime that you want just to get your exercise. So these have to be also concerns.
So
But
true.
also things like hypertension and diabetes, which are also made worse by some of our lifestyle choices. But once they develop, though, it requires medication usually to control these things. So hypertension, high cholesterol, and diabetes are probably the top three related illnesses that predispose patients to developing coronary artery disease or narrowing of the blood vessels.
Okay. Well, doctor, you are a consultant cardiologist. I want to ask you how prevalent or how common is this in Jamaica?
Uh, Boy, it's hard to say, and I guess it depends on the patient demographic that we're looking at. Um, I mean, because we don't really keep a lot of statistics in terms of saying, well, 10% of the population or whatever is going to develop coronary artery disease. I mean, I can give you some of the incidents of things like hypertension, where almost about a third of the Jamaican population is going to end up being hypertensive, depending on the definition. And if you use some of the newer definitions, which use a lower number for blood pressure, you're looking at numbers of almost 50% of the Jamaican population, as determined by a Jamaican health and lifestyle study. So when you look at those kind of numbers, you look at,
50%?
yeah, depending on the average, the number that you use. So
Okay.
some people will use the definition for hypertension as 140 over 90 as a blood pressure. But there have been some newer measurements proposed of 130 over 80, which, because it's a lower target, more people will fall in that group, which according to some of the data in Jamaica, falls to about 50%, and probably about 18% of the people are diabetic. So to exactly tell you how many people are going to have coronary disease, it's very hard because I don't think we have any systems in place to collect all of that data. Um, but I mean, cardiovascular disease is the number one killer in the world, generally speaking, in most of the developing and especially in the developed world, where people die from heart attacks or stroke quite commonly, or other forms of vascular disease. So it's quite common. I mean, we probably would see at least one, maybe two patients coming in every day with a diagnosis suspecting to be coronary artery disease. Of course, many people come in with chest pain, and sometimes after some amount of evaluation, we find out that no, it's not actually a heart. It might be acid reflux, which is a very
Oh,
common one, and which can sometimes be very difficult to differentiate between the two.
okay. Thank you so much for that, doctor. Well, take a little break in a minute. All right. Thank you. So, what are some of the symptoms associated with this problem?
Okay, sure. So there are two main ways that somebody with coronary artery disease can present. You can present as either a stable patient or an unstable patient.
Okay.
So the stable patient is the person who will have what's called angina. So they walk
Angina.
as angina, Angina, not to
Oh,
be confused with another word that might be, you know, angina. So,
wow.
right. So angina is actually chest pain
Yes.
due to coronary artery disease, classically described as being a crushing or pressing type of chest pain. So the actual nature of the chest pain is something that we take into
This
account.
is
Um,
lovely.
and it also is usually brought on by exertion when it's very stable. So it's usually a set distance that they'll walk or a set activity that they'll do to bring about the chest pain. The unstable type of category for these patients include the myocardial infarction set of syndrome. So where they can have a sudden onset chest pain, not necessarily related to any type of activity that they're doing, which doesn't go away with rest. So the stable one tends to go away once you rest, but the heart attack or myocardial infarction, as it's also known as, um, the pain tends to be continuous
Oh,
over a long period of time. The stable angina tends not to cause death, but once you have a heart attack, you can die very suddenly. And about half of the people who die from heart attacks die even before reaching the hospital.
my
So
God.
prevention really is where we really need to address most of our efforts. And we see that a lot of our patients coming in, really hypertension is the biggest driver for this. And there are a lot of people who are hypertensive in the world who don't even realize that they're hypertensive. And for those of the people who do realize that they're hypertensive, not many of them are actually seeking treatment for it, or they sought treatment, but they're not adhering to the treatment as
Yeah.
prescribed. It's not uncommon that we meet patients, they have blood pressures extremely high, and we say, has anybody ever told you that you're hypertensive? Say, yeah, doc, they tell me that the pressure was high one time, but I never really go back. They prescribed some
Yes.
medication.
You never follow it up.
I took it from month, the medication finished, and I never went back to the doctor after that. And that's like 5, 6 years ago that they haven't been getting any treatment. And all the time while your blood pressure is high, it causes damage to different organs and the different vessels until accelerating the buildup of the plaque. And when one of these plaques rupture, it causes a clot. And this clot can occur very suddenly, and which is what leads to a heart attack. And a similar thing happens in cases with strokes.
Oh, okay.
It's basically a clot that arises very suddenly in the vessel. It blocks off the vessel, and once the
Yes.
vessel is blocked, no blood is flowing, so
My
therefore the heart
God.
becomes starved of oxygen.
Yeah, and that's not good at all.
Oh, not good, because anything that's starved of oxygen dies, as a as a very basic principle. So,
Yes, yes.
and
Sadly.
depending on how much of that muscle dies will determine how you progress. So if a large part of the heart dies, then that person will be more sicker and more likely to die suddenly than
Yes.
somebody who only a small area is dead. But they're all bad. A heart attack is a serious thing, but there are
Yes.
varying degrees of severity and varying degrees of damage that can be done as a result of a heart attack.
Okay, thank you so much. Is this a death sentence? Is this disease a death sentence?
No, I mean, so early recognition is important. So
Yes.
if you feel that you're having a heart attack, the first thing that you should do is to take an aspirin to chew. So you have to
Oh,
chew it up, not just swallow it, but you have to chew it up
chew
so
it
that
up, the
it's
aspirin.
right, because you want to make it powdery so that it gets absorbed faster.
Okay, in the
Because if it's
blood,
in the
yes.
tablet form, right. So if it's in the tablet form, it has to be broken down by your body. So if you chew it up, you're already starting the process from that start. And then you should seek immediate medical attention by going to the nearest hospital emergency room. So that's not a case where you would go to a doctor's office. If you think you're having a heart attack, you go straight to the hospital, because a doctor's office is not equipped to deal with that kind of emergency. Every once in a while, I'll have a patient who may call me at the office and they'll say, Doc, I think I'm having a heart attack. I want to come see you in your office. And I tell them, no, please don't come to my office with your heart attack. You're
Yeah.
going to die in my waiting room beside all the other patients,
Oh
which might
my,
make it a little bit uncomfortable for them
a
and
little or
and,
very,
and very
very
awkward.
uncomfortable.
It's kind of awkward to be sitting down beside somebody who's dying. So
Yeah.
please go to the hospital where they have proper monitoring equipment, the right types of medications to give you to bust up this clot. They have clot busting medications. And there's also a possibility that you can go and have a procedure done called an angiogram and angioplasty, where they can actually put tubes in the heart with a balloon to actually blow them up to open up that area that is blocked, restoring
Oh,
the blood and preventing that heart muscle from dying. But if you wait too long and the heart muscle dies, then even if you open up the blood vessel, it's not going to be to any benefit. So you have to get the treatment before that heart muscle dies. There's a saying in cardiology, time is muscle. So
Time is more
the more muscle dies. So you want to
right.
minimize the amount of muscle that dies, your heart muscle.
And early detection saves life.
Definitely. Definitely.
Yeah.
It's important that if you think you're having a heart attack, you go straight to the hospital.
Now, okay, so once a person is diagnosed with the coronary artery disease, can it be treated?
Sure. So there are a number of medications that are available. Things which start from things as simple as aspirin, just regular aspirin that you can buy off the shelf.
Yes.
But it also includes other medications to reduce the cholesterol in the blood, medications called statins, and other medications called beta blockers and ACE inhibitors. But the point is that there are medications to help to reduce your risk of dying from a heart attack. And I have a number of patients who have had heart attacks who did receive early intervention, so they were able to preserve most of their heart function, who I've been seeing in my office for at least 10 years now,
Mm.
and they're still going strong. But it after having a heart attack, it's important that you stop smoking if you were smoking before. You take the medication as prescribed. We try to get good control over your blood pressure, your diabetes, and also exercise and that. So it's not any one thing. It's not here, take these pills, all is well with the world, but your lifestyle is still very important. And
So,
it's important because some people think, oh, if I exercise, I'll be good, or if I eat right, I'll be good, or if I just take tablets, I'll be good. And it's not any one thing. It's everything. We need to treat everything if we're going to have the best outcome.
so those are some of the ways we can prevent this disease from developing:
Absolutely.
exercising and
Absolutely. Because
monitoring.
because if hypertension and diabetes are some of the biggest drivers, if you can prevent yourself from developing hypertension and diabetes, then your risk is even lower.
Yes, yes,
So and this prevention really starts from school age, from your child,
yes,
and it's about building habits and teaching our children proper habits, and probably trying to get them not to follow the paths that many of us have, and trying to really pay attention to the things that are really good for their bodies, and hopefully their minds as well. But encouraging healthy habits from young.
okay. Thank you so much. Now, I know that you mentioned some of the treatment options available. Can this be cured? Can this disease be cured?
No, so that's the problem. That once you have coronary artery disease, it
Yes.
means that cholesterol plaque is already in the blood vessels. So that's what it means. And because the cholesterol, it's not like something that's just sitting on the vessel, as in your pipe, where you can just push a rod down there and push it down the line. This is actually
Yes.
within the wall of the vessel. It's actually infiltrating the wall, and you can't get it out of the wall. It's kind of like mold.
Oh
You
my.
can't really get it out, and sometimes you need to tear it down. Except you can't tear down your whole blood
Yeah.
vessel. You're there and you're stuck with it. So we try to prevent further buildup of plaque by using medication. Sometimes we need to use the balloons to open them up. And in other circumstances, it may require surgery, what we call bypass surgery, where they
Oh.
actually take vessels from other parts of the body, for example, the leg, or or the vessels in the chest, where we create like a detour around the area that's blocked. So if you have a blockage, you can plug in a vessel before the blockage and after the blockage, so that the blood may flow around. This still doesn't is not better than what God gave you,
Yes.
but what God gave you, nothing can replace. Everything we're doing is a second best.
So
Right?
true. No.
Right? So the point is try to preserve what you got in the first place, but in the
Yes.
case that you haven't, then we'll have to take these alternative methods.
Right. No, thank you so much, Doc. As we're about to wrap, is there anything else you'd like to add before we go?
Um, well, no, I think we've covered most of it for most people. I mean, really, it's just to get regular checks to ensure a healthy lifestyle, and also to go for well doctor visits. So it's not only when you're sick that you're going to see the doctor, because if you have hypertension, you're not going to have any symptoms, because hypertension is known as a silent killer. So the only
Oh,
way you're going to diagnose it is by actually going to get checked. So once you cross 40, I think that everybody should go in for a regular check, not necessarily to a cardiologist, but to their general physician,
okay.
their family doctors, their health centers. These are usually pretty available and accessible. and also a lower cost than going to see a specialist.
Yes, yes,
Uh,
yes.
so that's really where you start. Go for those well visits. Let's identify things early. If you do develop hypertension, let's identify it early. Let's get on it. Let's treat it. Most of them are pretty simple to treat and really do reduce your risk in the long run.
Thank you
So
so
prevention is
much.
better than cure,
Prevention
always.
is better than cure or treatment in this case, since it
Yes,
can't be cured.
absolutely, because it
Thank
can't be
you.
cured.
Yes,
Control is the best we can hope for.
control is the best. Thank you so much. And that's it for Body Talk this week. I trust you were informed. And thank you so much, Dr. Mark Husang, for educating us this afternoon. I learned so much.
Great. Thank you for having me. I'm glad that I could help you out.
Oh, thank you.
Education is also very important. I mean,
Yes,
we have
yes.
to know what's happening because we have to know about our bodies in order to treat ourselves.
Thank you so much, Doctor. Thanks again. And you're located at UHWI.
Yes, I work both at the University Hospital, but I also have a private practice at the Winchester Business Center.
Oh,
That's
how
at
can we
15.
contact you?
That's 15 Hope Road, suite number 33, and the office number is 906-5666 or 5666, which is kind of ironic given the station that I'm on right now. It's not a sign of anything. I'm just saying. It's just
Thank
the number
you.
they gave me.
I understand. I understand.
Okay,
Thank
good.
you so much. That's
Yes,
876-906-5666. That sounds better.
yes, that's
Thank
good.
you so much for your time again. Thanks for joining us inside Body Talk.
Alrighty. Thanks a
All
lot
right.
for having me. Bye bye. Have a great
Bye
day.
bye.